Welcome to this week's edition of Coronavirus Boosters. First, let's review where we are with the COVID-19 numbers in the US. As you can see, we see drops throughout, daily cases, currently hospitalized, which is really important, and daily death. What we can also see is that the number of daily cases, the average number of daily cases, still has not dropped to the numbers we had between what we could call wave 2 and wave 3. So despite this drop that we all should be very happy about it, we still see high numbers per week in the US right now. What are the big topics this week? Vaccines and mutants. We now have 3 vaccines that are approved and being administered in the US. The Moderna vaccine, the Pfizer-BioNTech, and the Johnson & Johnson vaccine. Still lots of conversation, maybe even concern out there about, do these differ in efficacy? Which vaccine should I get? Which vaccine will I get? Of course, the Johnson & Johnson vaccine has the advantage that it's a single shot. You will not need a booster within a few weeks. While for Moderna and the Pfizer-BioNTech vaccine, you need to go back for a second booster. The bottom line is they're all very effective. While there might be some differences in the percentage numbers for protection that you see out there based on the trials, you need to understand that the trials and the trial design are very different. No 2 trials are exactly the same. How many people are enrolled? How much COVID-19 transmission is happening in the community? What variants do we have out there? In particular, what type of people do we have enrolled? A trial can easily look like it leads to a lower efficacy if you have more patients, more participants that are immunocompromised and therefore less likely to mount a strong immune response. So take whatever vaccine you can get whenever you can get it and whenever your number is up. There's no need to worry about it. And all experts throughout are basically clear that there's no need to worry about which vaccine you're getting. They're all approved. They're all good and very effective vaccines. The second big news is the UK variant, or B.1.1.7, which is still spreading in the US and is increasing in the number of cases that it causes. This is a graph that shows that. So on the blue on the left side, we see the percent of cases in the US that are caused by this variant. And we've reaching more than 20% over the last few days. So about 20% of cases in the US are caused by this strain. And here you can see numbers have gone down, but the proportion of cases caused by this variant are high. What does that mean? What's the take-home message from this one? It shows that this variant is likely to be more transmissible. So it is important to maintain a laser focus on prevention. Face masks, social distancing, hand washing. We can't get off track from that, and we cannot get confused with the messages we see from some states which are relaxing various mandates, face mask mandates, opening up more and more for indoor dining, etc. Don't misinterpret that as it's okay to let our guards down. We need to keep our guard up, particularly in our food processing facilities with our food-related employees, but also in our personal time. As I said before, get vaccinated when it's your time and when you can. Help your employees get vaccinated. If you have not yet have a plan, how you will do this, how you will encourage your employees, I'll encourage you to revisit that. Time off for employees to get vaccines, bonuses, all incentives you can give people to get vaccinated is a great idea. We need to get as many people vaccinated as quickly as we can here. Hope you found this wrap up for this week useful. This work is supported by USDA NIFA grant. Thank you for your support, and stay healthy and do what you need to do. We all know what it is. Thank you.